We Care Solar.
Hi, could I have the first slide? So I'm going to be talking about sustainability and how it applies to maternal mortality and newborn mortality. About 300,000 women and 1 million newborns die every year from complications of pregnancy and childbirth. But I want you to imagine right now that you're not in Abu Dhabi, but you're in a small village in northern Nigeria, and you're trying to have a baby. You're one of the 15 million women who are having a complication this year during your pregnancy. And even though you haven't had prenatal care, after 2 days you realize something is very wrong. Your family takes an arduous journey to bring you to the nearest hospital, where a midwife ushers you in. She tries to understand if your baby is still alive. She wants to know why you're bleeding so heavily. She tries to contact a doctor to perform a C-section to save your life. And this is the only light available. This is the grim reality for millions of women around the world, part of the reason why in sub-Saharan Africa, women face a lifetime risk of dying in childbirth of 1 in 38. Why are so many women dying in childbirth? Well, part of the problem is poverty, a lack of education, and a lack of access to good care. But part of the problem lies in the health facilities themselves. For even when women do arrive at hospital, many of them can't survive. This is a hospital in northern Nigeria. It serves a city of 1.5 million people and does 150 deliveries every month. I went there in 2008 to try and understand why 3 to 8 women were dying every month from complications of pregnancy and childbirth. And I'm an obstetrician, and I've always considered pregnancy to actually be a joyous event. Well, this is labor and delivery. It's a far cry from what I was used to in my own hospital. None of the equipment and none of the fancy gadgets that we use, not even privacy. I had anticipated that the resources would not be the same as what I was accustomed to. But what I hadn't realized was that a hospital serving such a large city could be without electricity for 12 hours a day. What does it mean to be a hospital without electricity? It means that C-sections were conducted by the ambient light of windows because they couldn't use the overhead lights or the surgical equipment that relied on electricity. It meant that blood transfusions could only be done if you brought in someone who had the same blood type as your own because there was no refrigeration to store blood in a blood bank. It meant that if they had to assemble an emergency team to do a C-section, like for this woman who was hemorrhaging, the only way to find someone to help was to have a messenger run around the hospital compound looking for doctors and nurses who could be the team to perform a C-section. And at night, it meant that this was the only light available in the maternity ward, so that midwives had trouble starting IVs, assessing patients, or performing even the most routine tasks. I was pretty upset by what I saw, and I began to write home to my husband, who was doing solar electricity education in the school system in California. And he said, let's try and help the hospital. Let's bring solar energy. And he devised a small demonstration kit that I could pack in my suitcase and bring to my colleagues to show them what we had in mind. Well, immediately people actually wanted to use the demonstration kit. And I said, you don't understand, we're bringing in a much larger solar electricity system. And indeed we did. We brought in power for the operating theater, which went from looking like this to this. We brought in power for the maternity ward. We brought in a solar-powered blood bank refrigerator. And over the next year, the death rate in the hospital dropped by 70%, and women were no longer being turned away at night because of a lack of electricity. Now, I thought we were done, but my colleagues had something else in mind. They brought me to nearby clinics where some of the health workers said to me, why are you only helping the big hospital? We're in the dark as well. And I realized that we needed a solar electric solution that could scale. And my husband and I began to think about that suitcase-sized demonstration kit. And then we began to pack solar equipment in small suitcases that I would actually carry back to Nigeria each time I would return. Well, word spread, and soon we were getting requests for these from around the world. And this is what my backyard looked like in those days. We were creating a whole assembly line to volunteers to make solar electric kits to bring to health facilities. And then someone wrote about us in the Times, and soon we couldn't keep up with demand. And I started a nonprofit called We Care Solar, which now creates solar electric systems for health facilities. This is what the Solar Suitcase looks like now. It's a medical-grade, institutional-grade solar electric system that's compact, rugged. It has solar panels that go on the roof. It's reliable and safe. And what does it look like when a health facility gets one of these? Well, the Solar Suitcase becomes a cabinet that can actually fix on the wall, and it provides around-the-clock lighting. It provides charging for cell phones so that emergency care and emergency transportation can be achieved quite rapidly. It also includes an electronic fetal heart rate monitor so that we can listen to babies' heartbeats and decide which ones need cesarean sections. And the lighting can be used for all sorts of procedures, including surgical C-sections as well as resuscitations for newborns. But technology alone isn't enough. We needed to also bring in education. We needed to train health workers how to use solar electricity. And so we began an education program where I was training midwives to actually become trainers in their own countries. And soon the midwives were saying, well, can't we be involved in the solar installations themselves? And we thought, well, you know what? Women should be the change makers for this program. So we started a Women's Solar Ambassador program where we had women creating training programs that we then brought to different countries to build local capacity in solar installation. So they would lead trainings with district health technicians. And using this model, we have worked with partners that are UN agencies, international NGOs, and ministries of health that will help us find the health centers in need and that will pair the solar suitcases with other programs to support maternal and newborn health. Using this model, we've reached more than 4,000 health facilities in 20 countries. We've trained more than 16,000 health workers, and we've served more than 3.9 million mothers and newborns. We've had impressive results using these partnership models by collaborating with agencies that are working to improve maternal and newborn health. We've seen marked drops in maternal mortality, in newborn mortality, and an increase in utilization of these health facilities. In addition to the work that we're doing in maternal health facilities, we found that the Solar Suitcase is a very appropriate technology when immediate electricity is needed after humanitarian disasters. So after the typhoon in the Philippines, after the earthquake in Nepal, we sent hundreds of Solar Suitcases and our education programs to try and strengthen healthcare when so many people were in need, and more recently after hurricanes in Puerto Rico and in Haiti. But our most ambitious project is called Light Every Birth. Light Every Birth is an initiative to try and ensure that every woman everywhere has the power needed to survive childbirth. We want to reach every health center in a country, and we started with Liberia, and I'm pleased to say that last year we reached more than 430 health centers, and now we can say that every woman in Liberia has a public health center that has reliable electricity for her delivery. We're trying to build a coalition of partners to work with us for Light Every Birth, united by three fundamental beliefs. One is that all women have the right to safe childbirth. Second, every health center is entitled to reliable electricity. And third, clean, renewable energy is the appropriate and immediate solution to this global challenge. So in order for us to scale up, we're now trying to reach 5 full country saturation in 5 years. That's going to be 8,000 health facilities, and that will be serving 16 million mothers and newborns. To do that, we need to increase our education so that health workers know how to use our technology. We need to create sustainability programs so that once the technology is installed, it's going to last for years, and we've included remote monitoring on our newest Solar Suitcases. We need to work in partnership with governments and districts to ensure that there's an entire infrastructure that's available to support these programs. And using this comprehensive model, we're positive that we'll be able to ensure that every woman is able to have a safe delivery in a clean, well-lit health center. I'm going to leave you with one final story. Even as we're scaling up, there's a story that touches me the most that happened in the DR Congo. It's the story of a doctor named Jacques Sebasaho. He's in the orange t-shirt. He asked for a solar suitcase for an island clinic that had no electricity. On the day it arrived, he was able to deliver a woman with twins safely, but on the next day, there was an outbreak of cholera. For the next month, he treated 122 mothers, newborns, and family members with cholera. He told me in the past he used to lose 50% of his patients to cholera, and 80% of those deaths happened at night. He said with the solar suitcase, nobody died. He said we are witnessing what light means in communities where night means death to those in need of electricity after the sun goes down. So now I ask you to think about a world of light rather than a world of darkness. Imagine if every health center had electricity so that midwives no longer fear going to work at night. Imagine that mothers no longer need to bring candles or kerosene as part of their birthing kit. No woman should die giving life. We have a solution. We have the power to make these changes. We welcome anyone here to join us on our Light Every Birth mission so that every health center can have the power to save lives. Thank you.